Hello, this is an overview of the School Care Yellow with Choice Fund Open Access Plan. This overview will review all the parts of the plan and how it works. During this first deductible phase, you'll pay 100% of the Cigna contracted rate for covered services before the insurance plan starts to pay. For example, just like your car insurance, if you have an accident, you must pay a deductible first and then the insurance plan pays. Once you've met your deductible, you'll go into the second phase of coverage, which is coinsurance. Coinsurance is when the plan pays a percentage of the cost and you pay a percentage of the cost up until your out-of-pocket maximum. The out-of-pocket maximum is the sum of your deductible amount and your coinsurance amount. When you reach your out-of-pocket maximum, you'll pay no more out-of-pocket for covered services for the rest of the plan year. It's the most that you would incur ever in any given year. Here are some highlights of the School Care Yellow Open Access Plan. First, it provides the same level of coverage of treatments, hospitals, and prescription drugs as all other school care plans. Your preventive care and certain generic preventive drugs are covered at no cost to you. All other covered medical services and prescriptions apply to a deductible and then coinsurance up to the annual out-of-pocket maximum. Once the out-of-pocket maximum has been met, all covered services and prescriptions are then covered at 100% for the remainder of the year. This plan includes a choice fund embedded HRA, which pays the first part of the deductible automatically. The built-in choice fund HRA pays towards the deductible once it has been activated. The choice fund is technically an embedded health reimbursement account, an HRA. It's activated when the subscriber completes a confidential health assessment at MyCigna.com. This must be done each year in order to activate the choice fund. Current participants can take the health assessment between June 1st and July 30th each year. New Cigna participants can take it starting July 1. Biometric data is not required. For an individual, that's $1,000. For two-person and family coverage, it's $2,000. If in any given year the choice fund is not used in full, any remaining balance will roll over into the next year. Now we'll review the summary of benefits. The plan uses Cigna's National Open Access Provider Network. Preventive care is no cost. The choice fund will pay $1,000 or $2,000 towards the annual deductible as long as the subscriber completes the health assessment at MyCigna.com. The deductible is $1,250 for single coverage and $2,500 for two-person and family coverage. After the deductible, you will pay 20% of medical charges and 10% of a prescription, but no more than $75 up to the annual out-of-pocket max. The out-of-pocket max is $2,000 for single coverage and $4,000 for two-person or family. All medical services accumulate to this equation, including doctor visits, telehealth, behavioral health visits, etc. It also includes emergency room and urgent care visits worldwide, tests, labs, and hospitalization. You have 60 combined visits for speech, physical, and occupational therapy. You have 20 visits for chiro and 12 visits for acupuncture. Durable medical equipment, including hearing aids, insulin pumps, CPAP machines, all accumulate to your out-of-pocket maximum. Prescriptions apply as well to this equation. After meeting the deductible, you will only pay 10%, but no more than $75 of the cost of the medication. So let's illustrate how this works for an individual. The deductible is $1,250. By completing the health assessment at MyCigna.com, it activates the choice fund of $1,000. That's going to pay first towards any deductible expenses, whether it's an office visit or a trip to the pharmacy for a prescription. Once the $1,000 choice fund has been used, the individual is responsible for $250 of deductible expenses. Then, when $1,250 has been met, you've reached the deductible and now coinsurance starts. You will only pay 20% of medical claims, 10% of the cost of a prescription, but no more than $75 until a total expenditure of $2,000 has been reached. When the first $1,000 has been paid by the choice fund, the second $1,000 has been paid by the individual. From that point on, all services will be covered at 100%. Now let's look at two-person and family coverage. Two-person and family coverage has a $2,500 deductible. The subscriber completes the health assessment at MyCigna.com to activate the $2,000 choice fund. That $2,000 fund will pay the first portion of the deductible expenses for any member of the family, whether it's a trip to the doctor or a medical service or a prescription. Once the $2,000 fund has been used, then the family will incur $500 of deductible expenses out of their own pocket to reach the $2,500 deductible. At that point, coinsurance charges apply. You will pay 20% medical charges and 10% of the cost of a prescription, but no more than $75 for an additional $1,500 until the family's expenditure reaches a total of $4,000. The first $2,000 having been paid out of the choice fund, the second $2,000 having been paid by the insured. Again, after that amount has been reached, all services are covered in full for the rest of the year. MyCigna makes it easy to keep track of all your transactions. First, you can log on to MyCigna.com and click on Claims and Balances to review the transactions for your family's medical services and prescriptions. You can also call into Cigna 24/7, 365 and speak with a phone representative for questions and customer service issues. And lastly, Cigna has a mobile app that you can download to your smartphone and have all the information at your fingertips. You can always call School Care if you have questions about your benefits at 603-836-5031. The School Care website, schoolcare.org, is a great resource for plan documents, resources, and other information, including details about the Good For You well-being program. Thank you for watching.